Chest pain, one of the most alarming symptoms you might see in a child or adolescent. Fortunately, it's pretty straightforward to make sense of and understand, and I'm going to break it down for you right now in a very simple manner. So when we look at chest pain, we think anatomically. So what are the anatomic things we have in our chest? There's not a whole lot. You've got your chest wall, of course, on the outside. Underneath your chest wall, you've got the lungs on both sides, you've got your heart, and you've got your esophagus running up from the stomach. Those are the four major areas that we consider when a child has chest pain. In terms of the chest wall itself, you can get something called costochondritis, which is basically just an inflammation of the chest wall itself. It might occur if a child's been coughing a lot, maybe they got hit in the chest. Sometimes it's sporadic. It's generally benign, and a good way to know you have it is if you press and touch the area of pain, there's tenderness, which usually means it's a surface level pain. Sometimes raising the arms and things might trigger the pain as well, and it self-resolves within a couple of weeks and responds well to Tylenol and Motrin. Now, beneath the chest wall, you've got your lungs. The lungs, you obviously consider lung pathologies like pneumonias, pleural effusions. Most of these you can hear with the stethoscope. If everything is clear on a stethoscope, that's a good sign. If you want to take it a step further, you can even get a chest x-ray to make sure the lungs are clear. In terms of the heart, the big red flag for the heart is chest pain with exertion. If a child gets chest pain triggered by working out, exercise, going upstairs, that's usually a red flag for a heart issue. You might also have some family history of heart problems, or hear a murmur on exam, though not always, or feel some abnormal pulses. Any of those, it's usually good to get a cardiac workup, which usually includes an EKG and an echocardiogram. In terms of the esophagus itself, the most common thing associated with that is heartburn and reflux. So you'll feel the heartburn, and it's usually pain that you get when you're laying down, when food's coming up, maybe right after a meal, and responds well to things like Tums, drinking water, sometimes dairy, and usually you can get that worked up by a GI doctor if it's not getting better or going away. So those are the major areas that we consider with chest pain and the types of workup that we do. Hopefully it clears things up just a little bit more for you.